So my chapter is chapter 7, which is hematology and immunology. My name is Wes. So what is hematology? What is immunology? Hematology is the medical specialty and study of the blood. So this includes anatomy and physiology. Immunology is the medical study and specialty of the lymphatic and immune system. So hematology is what we're starting with. I'm presenting 10 slides on each. So, excuse me. Hematopoiesis is this first term, which means to make blood, and this happens in the red bone marrow. So this produces erythrocytes, which we will talk about later. Or well, I guess it produces immature stem cells, which make into erythrocytes. And here's erythrocytes. Erythrocytes are just your red blood cells, and they're very important. They have your platelets in them. They carry oxygen, they carry nutrients throughout the body. But something interesting is they do not have a nucleus, and they are the only cell in the entire body that does not have a nucleus. Therefore, they die after about 120 days and aren't broken down by the spleen, which we will also talk about later. Leukocytes, these are your white blood cells, and there's about 5 different types: neutrophils, eosinophils, basophils, lymphocytes, and monocytes. And they're all responsible for the immune response in different ways. They fall under two main classifications, which are granulocytes, which include your neutrophils, eosinophils, and basophils, or agranulocytes, which include your lymphocytes and monocytes. As I said, each type is responsible for a different part of the immune response. Your neutrophils engulf and destroy bacteria. Uh, Eosinophils release chemicals that help destroy these bacteria. Monocytes also engulf and destroy bacteria and microorganisms. Lymphocytes produce antibodies, and basophils mediate your allergic reaction. Plasma. All right. Plasma means to mold or to form. Plasma makes up about 55% of your blood volume. Um, it's clear, kind of straw colored, and it's way less viscous than the rest of the blood. Plasma carries nutrients throughout your body, and it gets rid of waste products through the kidneys. Plasma contains albumin, which retains water inside the blood to stabilize your blood volume, pressure. This helps your heart, and it also contains electrolytes that aid in muscle constrictions and maintaining your blood pH. Uh, One such example is, what is it called? Potassium. That's my bad. You will get muscle cramps if you don't have enough potassium in your body, and plasma will carry potassium. Hemorrhaging. Now, hemorrhaging is excessive bleeding. This can lead to bruising on the skin, or if it's an out, exterior bleed, it's usually to an artery, and you will see spurting blood if so. This is very, very dangerous as you can run out of blood. There are also internal bleeding, but you have to go to a hospital for that immediately as you can't treat yourself. To treat external hemorrhaging, you can use tourniquets and stitching, but you can also use manual pressure with gauze, in which case you never remove that bottom layer of gauze, because if you do, you may reopen that wound and undo all your hard work. So just keep packing on more gauze if need be. Some side effects or symptoms, I should say, are confusion, dizziness, vomiting, and this is due to lack of blood. Your body can't handle it, so this is how it responds. You also may see tachycardia, seizures, and feeling cold. Septicemia. Now, this is an infection and it's bacterial. Usually, it comes from other tissues and then it gets into the blood. It can be life threatening. E. coli is one such bacteria that is responsible for this. With septicemia, some symptoms are high fever, which is fever above 103 degrees, so very, very warm. You may experience chills, weakness, and you may start to vomit. Antibiotics are the only real treatment for this, but you can also take other drugs to help yourself just feel better. Sickle cell disease. So this is a genetic disorder of the hemoglobin. And when the body has low oxygen, your cells become unstable. They'll deform into a sickle-like shape, and this can be extremely painful as it clogs up your blood vessels and it can even tear them up a bit. Um, the only treatment is pain meds, as it is a genetic condition. We just don't have the medical technology to reverse it. Anticoagulant drugs. Now, these are to use to prevent blood clots. Commonly used after surgeries because you don't want the body making a ton of blood clots. Because blood clots can cause heart attacks and seizures. Some examples of this are aspirin, Palix, Harapin, and Warfarin. This is an ethereal, excuse me, potent gun. Um, ethereal sorry, these drugs are used to stimulate the red bone marrow to produce more etherocytes. And as we talked about earlier, etherocytes are extremely beneficial, and these are sometimes used with certain diseases to replace red blood cells, so your blood can clot, and so you carry enough oxygen. Blood transfusion. All right, blood transfusions are actually very interesting. They're also kind of simple. So a blood transfusion is simply receiving healthy blood. And this is given to treat certain diseases or severe blood loss from hemorrhage. Such diseases that it treats are leukemia or other cancers, because this boosts the red blood cell count and therefore the platelets, which is affected during chemotherapy. This will help you fight off the infection. But you must receive the right blood type, otherwise, you may face life threatening circumstances. So now we are on to immunology. Our first term from immunology is lymphatic vessels. So, lymphatic vessels pump a clear fluid called lymph through your system. Lymph supports your entire body and delivers vital resources to your blood and helps dispose of waste. Unlike blood vessels, lymphatic vessels have a beginning and end point, whereas blood vessels are just a loop. This system starts as tiny little capillaries, then becomes lymphatic vessels, which turn into ducts, which empty into your neck veins and push the blood throughout your body. And lymph can also only flow one way, which is kind of cool. So these are your lymph nodes. If you go like this, you will feel two of them. Lymph nodes are there to protect you from infection. They filter lymph and help fight off those infections that are in vulnerable parts of the body. So you have lymph nodes here because your mouth and your sinuses are here, which are entry points for pathogens. And that is what lymph nodes are for, is to fight off pathogens. The secret thymus. Thymus is a pink lymphoid organ. It's found in the mediastinum and it is posterior to your sternum. The thymus shrinks as you age. This because it becomes less active. The thymus matures lymphocytes and makes them into something called T lymphocytes. T lymphocytes are extraordinarily important to your immune system and immune responses. The thymus is counted as part of the endocrine system too, as it secretes the hormone thymosin, which is responsible for maturing immunocytes. The spleen is next. The spleen is the largest organ in the lymphatic system. It filters blood for toxins, breaks down and recycles dead etherocytes, and releases B and T cell lymphocytes during times of infection. It also secretes epinephrine, which is essentially adrenaline. Okay, this is about allergic reactions. Allergic reactions are caused by hyposensitivity to an allergen. You can be allergic to anything, and they range from very minor reactions, such as having a runny nose, to pollen, to an anaphylactic reaction, which can be deadly. Symptoms of anaphylactic reactions are trouble breathing, vomiting, swelling of the face or other skin, confusion, dizziness, fatigue, and even seizures, as your brain is not getting enough oxygen, so it starts to deteriorate. And this is based off of histamines from the basophils. You can see a pack of EpiPens, which are the medicine that is used to treat anaphylactic reactions. I myself carry EpiPens. And sorry, I'm just waiting for it to catch up. As I said, I'm so sorry that my audio cut out. This is what I got. Alright, so now we're on to microorganisms. This is going to be a faster slide, as microorganisms was a very small part of this, as it is a part of every single chapter, I believe. Microorganisms, not all of them are harmful. In fact, I think it's about 1% that are actually harmful. Microorganisms include bacteria, viruses, protozoa, fungi, and yeast. And those that can cause diseases are pathogens. If a pathogen or a cancer cell is detected, immune response will be triggered. So lymphoma is cancer of the lymphatic system. This can be on lymphocytes, lymph nodes, or lymphatic tissue. So basically all organs. There are two main types of lymphoma, and that's Hodgkin and non-Hodgkin lymphoma. Hodgkin's is the most common. It's found during a physical examination as there's a palpable tumor. And a biopsy will reveal deformed leukocytes. Excuse me. Splenomegaly is enlargement of the spleen. This can happen for a number of reasons, such as mononucleosis, cancer, or other infections. Trauma can cause it too. You will, with palpitation, you will be able to feel it bulging. And symptoms are extreme abdominal pain, weakness, fatigue, loss of appetite, and frequent colds and sicknesses, as you simply do not have your spleen functioning properly to help your body repel these diseases. The only treatment is really to go after the underlying causes of this. And this will translate into the next slide. Yeah, here you go. Splenectomy. This is a surgical removal of a ruptured spleen after it's suffered trauma or certain diseases. This can be cancer too, for why it gets removed. A ruptured spleen is life-threatening, so immediately seek medical attention if you think you may have one. You can live without a spleen, but you still really don't want to get a splenectomy because it does affect your life, and it is a severe surgery. You will have, you'll be more susceptible to infections, which is why it's almost absolutely necessary to quit smoking before you do this, because otherwise your body just cannot recover properly. And lymph node biopsy. This is my last slide, and in it, a needle is used to suck a piece of lymph node tissue. That tissue is then examined for cancer cells, and if cancer is detected, the lymph node is removed through a process called an incisional biopsy. And yeah, that's that for this. I will wait for me to catch up. And now, as you can see, I am on the credits. This is credits for every picture that is on each slide. And then here are my information sources. For certain terms, I used extra sources, but for every term, I did use the textbook too. Also, in the YouTube video, in the description, all the links should be there too. Thank you so much, guys. I'm sorry this happened. Have a great day.